Hi, everybody. I'm so glad that you all came out in this nasty weather. We have a really exciting discussion today. So as Jen said, we're going to jump right into it as soon as Carol Joyner gets here. She is delayed with weather. So first and foremost, thanking co-sponsors, Tufts Civic, Political Science Department, Tufts Democrats, Tufts Republicans, Tufts Young Democratic Socialists of America. We really appreciate your collaboration and support. So we're actually trying something new this semester, which is to have a theme for both our Civic Life Lunches and our Solomon Speaker Series. And the theme is the fight to save democracy. We feel like in this moment, who'd have thought we'd ever be here? But here we are. It's really important to focus on the challenges and the opportunities now facing us, given kind of what we're learning about the weakness, frailty of our democratic institutions. So what are all the things that contribute to strengthening democracy? And so today we are hearing from Carol Joyner and Elizabeth Remick in a dialogue about the fight for workers' rights and particularly paid family leave. So from Starbucks and railway employees to remote workers and parents and caregivers across the country, the rights of workers are at the forefront of the fight for democracy. So today's speaker has fought for workers' rights for the better part of 2 decades. Carol Joyner is the Executive Director of Family Values at Work Action and the former Director of Federal Policy for Family Values at Work. So it's a new, like a lobbying organization. Both entities focus on building worker power centered on caregiving and economic justice and are related entities of the national network of 27 state coalitions fighting for paid family leave in the states. Prior to Family Values at Work, Carol provided consultation on work and family trust fund and related labor administration issues. She was the founding director of the 1199 SEIU Employer Child Care Fund, which was a collective bargaining benefit that the employers had to pay for workers' child care. And it was a labor management collaboration. And it covered 400 healthcare workers, 400 healthcare work sites in New York State. She's a founding member of the New York Union Child Care Coalition, past National Advisory Board member of the Labor Project for Working Families and the Family Values at Work Network. She's a founding partner of the Work Family Strategy Council, as well as the national #PaidLeaveForAll campaign. Carol is also a member of the National Coalition on Black Civic Participation, Black Women's Roundtable. And moderating today's conversation is Elizabeth Remick, Tufts Political Science Professor. Elizabeth is Professor of Political Science at Tufts, where she teaches courses on Chinese politics, comparative revolutions, and gender, work, and politics in East Asia. Professor Remick is currently researching the origins of state-level paid leave programs in the US for her upcoming book, which seeks to understand why and how a few states have passed generous leave legislation, a few others less generous laws, and most others none at all. Her research also explores the consequences of this variation in paid leave policy. Fantastic. Professor Remick teaches a class on the topic called Topics in Comparative Politics, Work and Family Policy in Comparative Perspective. In 2013, Professor Remick was a founding member of the School of Arts and Sciences Committee on Faculty, Work, Life, and continues to advocate for work-life policies for faculty, staff, and students at Tufts. So please welcome Carol Joyner. Okay. And Elizabeth Remick, please come.
Oh, I'm not.
Thank you. And we have, for anybody who hasn't had a chance to get pizza, such as myself,
I know.
we have more pizza coming.
Happy to be here.
I'm gonna get out of the way. So Carol, do you want to take a second to breathe and maybe?
Well, I've been breathing a lot. Hyperventilating actually in the cab, but I'm okay. Thank you.
Very hard when you have to struggle to get somewhere like that.
Yes, and without, I think everyone's flown these days, so there's always some drama associated with it. And I couldn't connect with because the plane was just circling around the airport in Logan, waiting for a chance to land. See better weather, which we've got. But thank you so much for waiting and for being here.
We're really glad to have you.
Thank you
Thanks
for
for
this
coming to
talk.
see us. Well, we're delighted to welcome you, in fact, and we, understand that you've been working on issues related to family leave, paid family leave for a long time, and to related to caregiving and economic justice. And I wonder if you could tell us a little more about how you got involved in that.
Well, I was a graduate student and also teaching school in my early 20s, and wanted to think about how to both get my thesis completed and continue teaching school, and I realized that was impossible. And so I started teaching night school at a union, 1199, the Hospital Workers Union in New York, and there's an 1199 I know up here in Massachusetts. Connect with them if you ever have a chance. And I started teaching adult education and fell in love with the union, fell in love with the members, and never went back to teaching. And one of the things that I focused on more than anything was how to help union members who were trying to uplift themselves in healthcare careers to do that while they were working, because they had children, they had family obligations, that sort of thing. And so we designed a whole suite of programs for nurses' aides to become nurses and to put their children. We designed summer camp programs and after school programs for their kids so that they didn't have to worry about their children at that time. So I became this person at the union who could think through policy, through programs to support working families. And eventually when the union negotiated a childcare fund through collective bargaining, I became the founding director of the Child Care Fund. That kind of stepped off the whole relationship between sort of unions and labor and work and family policy, and just really thinking about the relationship between all of that and how workers actually are able to get their work done, but more importantly, how their families can thrive while they're doing it. So that became my focus for a very long time.
Wonderful. And as someone who's benefited from policies like that, I can say that those sound great. Could have benefited more. Can you tell us a little bit more about what you do at Family Values at Work?
So Family Values at Work is a network of 27, you're talking to me, but I'm going to speak to them. That's okay. Family Values at Work is a network of 27 state coalitions. And they essentially work with community organizations and unions and legislators in order to pass work and family policies like paid family and medical leave, paid sick days, and now we're also beginning to focus a lot on childcare. While those are easily passed on a state or local level, and they really do require federal engagement and intervention, building sort of the conversation with caregivers and parents and folks who need childcare, particularly coming out of the pandemic, builds the momentum on the ground for federal change. So that's what we do. Over the years, we've passed paid family and medical leave. When I say we, I mean Family Values at Work as sort of the base on the ground with a few other partners. And in a lot of state capacity. I'll talk about Massachusetts, which has been amazing in terms of these sort of policies, right? They've passed these policies in order to, build a more democratic conversation across their state. You know, it doesn't stop with paid family and medical leave or paid sick days. I think Massachusetts is a great illustration that they started with minimum wage. They passed minimum wage and paid sick days. They moved on, the coalition here moved on to paid family and medical leave. And then they took that same sort of amazing capacity and organizing, and now they're working on a revenue bill. You know, and some of those are all the same players saying, how do we capture more of the revenue that helps our families thrive and use it for ourselves and our communities, to strengthen our communities. So Family Values at Work is behind a lot of that work. And what we do is we crowdsource and we fund the coalitions on the ground. We also create peer-to-peer relationships with partners. So in Massachusetts, where they've done a lot of this work, we'll connect them to groups in Arizona that are trying to do the same thing so that they can share knowledge and they can talk about how bills got passed, and they can you know, think about how do you create more people of color power inside of your coalition. So they'll do all of that work. And so it's peer learning, it's funding, it's you know, having a conversation about what does the country need in terms of work and family and how do we get there. We also were deeply engaged in the federal fight during 2020 for the Family First Corona Response Act related to COVID, right? And the CARES Act, and then subsequently Build Back Better. Mainly because we knew that that was the only chance we were gonna see federal paid leave, which, as I'm assuming, since y'all have been learning about this, you know, doesn't exist in this country, right? Paid family and medical leave, as we know it, as a federal standard. So we saw that federal engagement since 2019 is the vehicle for finally seriously moving federal paid family and medical leave.
Could you tell us a little bit more about, you know, sort of what you're saying here about the push towards state level paid family leave and sort of what's the impetus of it and why is it happening now as opposed to other times? So just for those of you who don't know, there's been in the last maybe 15 years, 20?
Yeah.
20 years. I don't know what year it is. So yeah,
I know.
Since 2000, there have been a lot of state level paid family medical leave laws that have passed, including Massachusetts really recently, but there was no movement on that at all until about 2000. So,
well, I think it started with California. Yeah. In California, the Labor Project organization that I used to work with, at the time I was on the board for them, and the California State Federation worked together on a bill for paid family and medical leave and got that done in 1 year, which was a political sort of just miracle that it happened in 1 year from introduction. And, you know, I don't want to, I know we probably are short on time, so I don't want, it's an interesting backstory. Related to the recall of the governor and the governor willing to sign it very quickly and help push it through because in part he was recalled. However, when California passed paid family and medical leave, which really, have y'all learned about FMLA, Family Medical Leave Act, right? The unpaid system of leave in the country, right? About half the people in the country can get access to it. It is unpaid, but it's actually what we have on the books. So in California, they looked at FMLA and said, well, how can we structure a program that's paid? And they did basically that. They took the basis of FMLA, they created a paid system. There were a lot of weaknesses, but we were cheering them on all the way. One of the weaknesses was that only the wage replacement that people would get for pay was only like 55% of your salary, which is very low, particularly if you're a low wage earner. It's hard to live off of half your salary, right? The other problem was there wasn't job protection, which we'll talk about later as a real clear equity issue, right? And so, however, we celebrated that. It was the first one in the country that would provide at least a modicum of paid leave to people. And right after that, about 6 or 7 women from different parts of the country got together and said, we want more. We want to do that in our state. We want a state paid leave program. They decided they weren't going to create their own coalitions in order to build it, but that they would create a network and they would fund money, they would share the money, They would fund ideas. I mean, they would share ideas, and they would be peer, learners in this journey. And that was 20 years ago. And it began, that's what initiated Family Values at Work. Over that time, it's not a mistake that the first paid leave laws that passed were, so California we talked about, the next one was New Jersey, the next one was Rhode Island, and the next one was New York. And the reason those 4 passed was because each of those states had a foundation to build upon. Each of those states have a temporary disability insurance law that they've had since the 1940s, 1940, 45. And it was not easy by any means. It took 12 years to get New York paid leave. So it wasn't easy, but it was easier than starting from scratch. So you didn't have to deal with the resistance of legislators who said, well, we don't want to stand up any new programs, or we don't want government to be too big, or we don't, all of the resistance that comes along with setting up new social insurance funds. They said, and we said, these already exist, right? And so we're just going to build on top of it. On top of the medical leave that exists under temporary disability insurance, which is basically medical leave, we're going to build on top of that and add a family leave and a bonding leave program. And so that's what happened, and they were able to pull it off. For a couple of years, we were in this, working with these different states to pass these policies. Many other states wanted to engage, and a lot of folks said, well, you'll never do it because you can't stand up a new program. I mean, in this country, we have this idea that we can't do big things anymore. We used to do really big things, right? And we were saying, no, we actually can, we can figure it out. And luckily, during the Obama era, the Department of Labor, once we lost the House and the Senate under Obama, the Department of Labor got really busy with, well, how do we really focus on leave in a way that's meaningful? And they created a fund for states that were interested in building out a paid leave program. And so for a couple of years, Massachusetts and Washington and all of these states had access to this innovative money so that they can create the technical assistance, they can figure it out, how do you do it from scratch, how much money will it cost, all of that. And right after that, shortly after that, we then saw new states coming online. So the energy is really about, and always has been, how do you pass paid family medical leave on a statewide level and build the tipping point state by state so you can get to national paid leave. So that's always been sort of the goal.
Right. Could you just, most of these students are not in my class, so I think they don't know that much about, well, they might not know that much about paid family leave or unpaid family leave. So could you tell us just a little bit more about what we mean when we're saying paid family leave, and you mentioned that there are a lot of people who are shut out of it. So
yep.
Sort of what are the inequities in our existing system?
So a lot of people are shut out of the unpaid leave that we have that currently exists in this country. I think in '93, the FMLA, the Family Medical Leave Act, was passed. It was the first law that Clinton, when he was president, signed. And when that passed, it gave people job protection if they take time off to care for themselves because of surgery, injury, crisis, physical crisis, care for a sick family member, seriously ill one, or welcome a new baby. Years later, we added for military deployment, I believe. And so all of that's unpaid, remember? So that means that about half the population, can actually get access to it, but even fewer than that, mainly because there are also a lot of hoops that they have to jump through. You have to work 1,250 hours. I'm checking with you because I haven't thought about it in a minute. 1,250 hours. You have to be on the job for a year, and then it's unpaid. And so that cuts out a lot of people. And originally, when the FMLA was passed, it took about 8 years to pass it. So I said it started in '93. So we're going back into the '80s when they started organizing around it. Public policy moves slowly, y'all. You know, I think the original bill was 16 weeks, fully paid, without all of those hoops. But they wanted a bipartisan bill, because in this country, some people are in love with doing things in a bipartisan way, which we've learned over the years, that just means the bill's gonna be weaker. And sure enough, this bill was significantly weaker than what was introduced or championed. And so when we talk about paid family and medical leave, the last thing I'll say about the FMLA, which is, I think, really important. We're going into the 30th anniversary this year. At the 20th anniversary, under the Obama administration, the Department of Labor did a full assessment of the FMLA. Who's used it, who hasn't used it, you know, that sort of thing. At that point, it looked like 100 million people had used this bill. It's a lot of people, but also when you think about only half the people who needed it used it, right? The other important thing to know about it is that 25% of those people, of the 100 million people, used it to welcome a new baby. 75% used it to care for themselves, illness, cancer, surgery, etc., or a very sick family member. And so for us in the paid leave world, we began to sort of change the narrative. It isn't all about parental leave. This is about care in general. And more likely, we need to focus on care for yourself and care for family members. And the reason that we've stressed that is because a lot of conservative legislators who put forth paid leave laws, so-called paid leave laws, often just want parental leave for new babies, which cuts out a swath of the population, right? It even cuts out parents, if a 10-year-old breaks their leg or you know, tears an ACL playing soccer, right? They can't even take time for that child if it's just parental only. It's real, that means literally for newborns and for bonding. So that research that the DOL did, Department of Labor did, allowed us to sort of really frame, well, who are we doing this for? And what are we talking about in terms of leave? Another just quick thing, over the years, we've learned that there are other reasons, right, for paid leave. There's bereavement. And during when President Biden first came into office and he put forth a paid leave bill, it included a couple of weeks of bereavement. There are other reasons as well. So we're expanding our thinking about what we need leave for, because in this country, we don't think about care as much. I mean, we're just starting to, and the pandemic sort of has pushed us in another direction in terms of like, what does care mean for our communities, our society? What does it even mean for our democracy, right? The ability to sort of have, you know, equal access to caring.
Could you say a little bit about why the paid part of it is so important? Like, who is it making it possible to, who gets to take advantage of family leave when it's paid, who wouldn't have been able to do it before?
So I think that the majority of the population right now, under the, I think the statistics, the last time I checked, were that about 21, maybe 22% of the population working in the private sector has access to paid leave through their employer, right? It's about 21, 22%. And that's usually problematic. That means almost 80% don't have access. And that's why, if you just think about the pandemic, when people were, you know, had to check with their boss as to whether or not they could quarantine or not, many bosses said, no, we need you here. And folks had to decide whether or not they would go to work, you know, possibly get infected, possibly get sick, or bring their illness home to their families. And so there's that issue, and that's largely people of color, that's largely women, that's largely people who work for small employers or work in what we called during the pandemic essential jobs, right? And so during the pandemic, when they passed the Family First Corona Response Act, if you remember in March of 2020, the big bill that got passed, like $2 trillion or whatever, we really wanted a real paid leave program in that bill, something that would actually protect workers and families. And we were excited that something got passed, but what got passed was paid leave for parents to stay home and take care of their children who were, homeschooling because their schools had shut down due to the pandemic. That was the extent of it. And then we got paid sick days, but a very limited number of days, like 10 days, the exact days the CDC said you needed to quarantine. Forget that COVID was lasting 15, 20 days for many people. And we, compromised our health. We compromised the health of our families and workers. But if you think about the meat packing places and all the facilities that were having unbelievable contagious outbreaks, it was largely because people were being forced to come to work. And so this is for the people who, not necessarily for your Fortune 500 corporations, employees, because if they call in, they can probably strike a deal. They probably already have some form of leave or can cobble together vacation and sick time. This is for the people who have nothing. And most workers, as we said, 80% have nothing. 0 weeks.
0 weeks.
There's a film, if you want to know more about paid leave, Family Values at Work worked with a partner years ago and did a film that I believe is still on Amazon Prime called 0 Weeks. Gives you the background, 0weeks.com.
Do you think that the pandemic is going to change sort of the momentum here? Do you think there's any possibility that things will get better now that the sort of need for paid leave has become really clear?
Well, when I came through the airport, through DCA this morning, no one had on a mask. I don't have one on right now. You don't have one right now. Half of y'all don't. We've sort of moved on, right? And there was a moment, though, to answer your question in a more hopeful way, there was a moment where we were so excited because we knew that the pandemic was going to make this change happen. And so when we passed FICRA, we said, okay, they passed this law. It's the first time paid leave of any sort is on the books. Paid sick days is on the books. We can just make it stronger. Well, shortly after that, Mitch McConnell refused to continue that form of the program. Remember, they continued almost all of the provisions in the fall of 2020, but not that. By December 2020, they were adamant against any mandate. And that's the crux of the problem with paid family and medical leave, right? We think about it as, oh, they just don't want to give us the policy. Well, they've been fighting this tooth and nail for many years. Conservatives, the Chamber of Commerce, all kinds of employer lobby organizations.
Why?
Because maybe in economics class, you'll think about what does it mean for employers to have a mandate, a requirement that they have to provide something. And in this country, they are so averse to a mandate. And what paid leave says is that this is a mandate. You can't say no to this worker who needs paid leave. And by the way, we've already taxed the money, right? We've already got the money. So we're going to give them that money so that they can take the time off that they need to care for themselves and their families. So the employer no longer has control, right? At that point. And the mandate suggests that the worker has control because the employer has to comply. I think that's the crux of the issue. When I say this in non-union settings, people are like, oh, I don't really think it's all that. But I do think it is. I mean, that was Mitch McConnell's major obstacle with continuing to have a mandate for even the minor paid leave that was passed during the coronavirus.
Yeah, and there's always kind of the complaint about how it's going to cost businesses too much and they're going to go out of business. And
businesses don't generally pay for it. So in California, most of the bills that have passed are paid for through tax dollars. This is revenue. We're raising revenue to care for ourselves. How many people think that's a bad thing? Raise your hand. You think that's a bad thing? We're raising the revenue, our tax dollars, so that we can care for ourselves and our family members. So in California and in about 4 other states, it's all taxes. Tiny bit, you barely notice it. The cost, we used to say the cost of a cup of coffee before inflation. And so it's cheap, right? And so people didn't notice it. In California, when they were getting paid leave done, employers were really opposed to it. After paid leave got done, they loved it. It kept retention. Their employees stayed on the job longer. More men, for all the dudes in the room, more men were staying home to care for their children because now they got paid to do it. And it felt a little more equitable and available to them. People of color, we've had a hard time in California and other states, honestly, getting people of color to know about the policy and to use the policy. But the more you increase the wage replacement, the more that changes. Like once you're getting to like Washington or Massachusetts or Colorado, where the wage replacement is 90 to 100% of your wages if you are lower on the lower end of the income scale, then people are like, okay, I can do this. And if there's job protection, I can definitely do it. And some states have actually passed job protection. Rhode Island was the first state to include job protection, to close that gap that I talked about from FMLA, where some people aren't covered, right, under job protection.
You mentioned before a little more, again, about Massachusetts and how it and Washington and Colorado, but also I think Connecticut are coming up with sort of more and more developed policies. Could you say a little bit about what do you like, what's good about them and improving over what was happening before?
I mean, I can't sit here and talk about Massachusetts without talking about the Coalition for Social
Raise Up Massachusetts, maybe.
Well, it's Raise Up Massachusetts is the coalition. The organization that is our anchor in Massachusetts is CSJ, Coalition for Social Justice. And at some point, you all should invite Deb Festino in to talk about the work in Massachusetts. So Massachusetts was, I think one of the most innovative things about Massachusetts is, I have to take a step back to explain it. Remember I talked about the temporary disability states, right? All of those states have extended periods of time for medical care. 30 weeks, in California, 52 weeks. I think New Jersey and Rhode Island, maybe 30 weeks or something like that, right? For medical, and when they tacked on top the family care and bonding, it was 12 weeks, 12, 16 weeks less, right? But because TDI passed with a huge number of weeks, they have a greater number of weeks. In Massachusetts, I believe they also passed a law that has 20 weeks for medical, isn't that right? And so that's an amazing thing. All the other new states that passed have 12, and then I think Delaware's case maybe 6. So that's exciting. The other thing that I really love about the Massachusetts bill is it's the first time that they tried to tackle gig workers. And so how many people here have ever driven or used Uber and Lyft, either as a job or as a rider? Typically, it's really hard for them to get access to these programs. Why? Because they're considered independent contractors, which means they have to kind of pay their own share if they pay into the state fund, right? In Massachusetts, they said that any employer, so Lyft, Uber, whoever, DoorDash, who has more than 50% of their workers in that state doing that job, if 50% of their workers are doing it, then they are the employer. And so they have to pay for the employer share of the cost of the paid leave program. Because these are paid for in Massachusetts by employer and employee shares, kind of like Social Security as employee and employer, right, contributions. So it requires them to pay in. No other state has done that. And we should be thinking about that on a federal level if we ever get to passing paid family and medical leave, which I'm hoping we're gonna do in the next year.
Well, I was just gonna ask that as we have to stop to have the quick Q&A, but before we wrap it up, like, what do you think the prospects are of getting federal level paid family leave in the next 5 years?
I was like super hopeful until a year ago. Really hopeful. Oh my God, we threw everything on the wall for Build Back Better. We don't have a coalition in West Virginia. but we funded a whole lot of groups who are doing work in West Virginia to move Manchin, and Manchin wouldn't do paid leave. He was listening to the chamber and two or three others as well, not just him, listening to the Chamber of Commerce, listening to, receiving money and getting gifts and promises and support from folks who just refuse to address the issue that people don't have paid family and medical leave, right? Or childcare, in any meaningful way. So when they took paid leave out of the Build Back Better plan around this time last year, we went crazy in DC and all over the country with lobbying and rallies and all kinds of things. And then there were a bunch of congresswomen who were like, this one man isn't going to tell us what to do. And so they put it back in, Nancy Pelosi's insistence, I believe. However, Joe Manchin ultimately decided that he's not going to pass any bill or sign on to any bill. So, we spent a lot of this year really depressed about that. We've gotten so close and realized that, the Senate, as you know, has almost no margin, right? It's 50-50 in the Senate. And we only have the majority because we have the presidency, the vice presidency, who can break the tie. So we spent the whole year trying to build power. What does it mean to build power under these conditions? Because what we lost last year was, we lost because we didn't have the power sufficient to actually move Manchin, right? Other people had more money, they outspent us, they outlobbied us to him, right? And so the hope I think we have two hopes this year. One is that if we can hold on to the House and the Senate, and I believe that we can, and I hope that y'all send some of that good energy. If you are, if I can talk like that in this room, I can. So if we hold on to the House and the Senate, and we get some margins in the Senate, maybe at least one or two more, then the next budget reconciliation package, and so I don't know how many of you know this, but what's passed through Build Back Better, or what just was trying to pass through Build Back Better in the House, and what just passed through the Inflation Reduction Act are done through budget reconciliation. It means that you can pass the bill with a simple majority. You don't need 60 votes in the Senate. You don't have to deal with the filibuster, which is essentially our problem. We're hoping that if we can hold on and we can get more margins in the Senate, then we can maybe have a budget reconciliation package next year that is devoted completely to care. It includes childcare, because they cut the $400 billion that we need in order to stabilize childcare in this country, right? That includes paid family and medical leave, that reinstates the child tax credit, because that was slowly pulling people out of poverty, ending child hunger and all of that, right? We want to track for that for 6 months. And the fourth thing, home and community-based services, because elder care is still an issue, right? And so the goal is to, the Inflation Reduction Act didn't include any care. So could we have a budget reconciliation process that is totally devoted to care? Now that we've kind of done climate, we've done a little bit about student debt, not enough, right? So some boxes really have been checked with this administration. They haven't touched care. If we don't hold on, right, and we only have the lame duck, meaning the period from election day until January, in order to do something, then we also feel like we should, try to lean on Manchin once again to push through a care package through budget reconciliation during lame duck. So that's the goal.
Yeah.
Who knows where it's going to go? We're just beginning to strategize about this. When I say we, it's not just Family Values at Work in our 27 states, but we have a huge campaign. We like to call it a small movement of people working on care in this country. It's national partners, it's unions, it's the 27 state coalitions, it's Moms Rising doing their thing on social media, so many partners. And before we go to questions, I just want to say, we'd love for you to be involved. This is about your future. This is about your ability, just like, you know, I believe abortion rights is going to be one of the deciding factors of November. But I also believe that care is in that mix because young people, women and men, you know, want to be able to care for themselves and their bodies and have control over their futures. And these are the two elements that are missing in our society. So join the fight. Come volunteer with us. Work with CSJ in Massachusetts. You know, check them out. Go online. And know your care story. Everyone has one. Think about what is that? Who took care of me? Who am I caring for? What does it mean? What stress does it add to my life? How could it be alleviated? You know, all of that. Figure out your care story because I think it's really important for everyone to have that.
Great. Thank you so much. Many of us will have to leave shortly. If anyone needs to leave right now to run across campus to go to class, please do that. I'm gonna hang around for as long as I possibly can, but let's take questions from those of you who can stay for as long as we can.
Hi, I'm Carolina. I'm a senior here. Thank you so much for coming. I think one thing that I've been thinking about is what does it say for, I think the US is like the only one out of the top 40 economically developed countries that does not have some sort of paid family leave. What does it say about our American family values or our democracy, the state of our democracy? That's something that impacts literally everyone in this country. Either they are a caregiver, they can work because of a caregiver, or they like benefit from it. That's something so essential to our democracy is not there, and that we're not all fighting tooth and nail for it right now.
Yeah. You know, I think it says that our nation was built on the backs of women, and it was built on the backs of people who were enslaved. So we took all the caregiving work that they did for granted. And at the point that you have to pay for it, you don't want to pay for that. It's not valued. And so I think we need to have a realistic assessment about history and how we got here. There was an awakening in the 1940s in Western Europe, and even in some places in Central and South America, where they said we want to turn away from that. We don't want to, you know, build our nation on the backs of women. And we never did that in the United States because we're still struggling with, you know, who's entitled to have a life, who's entitled to have freedom. We're still struggling with that. And the Dobbs decision is a clear example, right? Who gets the right to say what happens to themselves, their body, who they care for, how they care for them, all of that is in question. And it's completely in alignment with the attack on our democracy right now, right? And so I don't think it's a question of, you know, the American family values. I always thought that, well, we use the name family values at work, which is hotly contested. A lot of people don't want to take that name, but you know, we have sort of reclaimed it. And the truth is that America has never really valued families. When you think about, you know, the numbers of children who were taken away, you know, in Native families and raised, right? Basically abducted. When you think about slavery, when you think about, you know, women not getting the right to vote, you know, for most of the history of this country, all of that. We've never valued family. And so the question is, as we try to actually deliver the truths or the sort of vision of the Constitution, right? As we try to actualize that, what are some of the pieces that are really missing, like this?
Yeah, hi, my name's Seth. I'm a
Seth.
senior. I was wondering if you could talk a little about just like the recent upsurge in unionization and union efforts, and sort of like where you see current unions, the state, and then also sort of like third-party individuals or organizations helping or hurting with that drive.
I think it's really exciting to think about so many folks. This is probably the largest uptick in union organizing that we've seen in a very long time. And I just think just keep going, keep doing it. I think it's directly related to what people experienced during the pandemic. You know, their lives were not valued on the job or in society. And folks are responding to that. A lot of times they are actually including time, like the Amazon workers in Staten Island had paid sick days as one of the demands for why they want to form a union. And so between safety on the job, time for yourself, your family, time to recover from this illness or whatever it is, and then of course over I think it's really critical. Finally, we're waking up to the fact that we've lost probably $30 trillion over my lifetime, right? That have literally gone from the working class to the top 1% because of neoliberal practices and policies. That's about the number. And we've lost it in tax dollars. We've lost it in so many different ways. We've also lost a lot through collective, because we aren't bargaining collectively enough. So the ability to, join in concert on the job, whether it's a worker center or a union or a, third-party organization, I feel like we need to just have it all happening all at once. And it would be great if we could do something in this country that there's some groups used to do and see some success of, which is to talk to one another as we're doing it and learn from one another. But I think it's very exciting.
Hi, I'm Nate. I'm a sophomore here at Tufts, and I was just wondering, we talked a lot today about how, given the current circumstances of our political climate, we have to sort of take a more realistic approach as to how to build policy, whether that's at the federal or the state level. And I was wondering, given that consideration of our climate, how do you forge policy recommendations to states that have, say, predominantly red citizens or predominantly red voters? And is there any sort of differentiation between the recommendations that you give to states, and how do you work with that?
So one thing I would say is that paid family leave is a bipartisan issue. The only place it's not bipartisan is on Capitol Hill. So in polling, 65% of Republicans think that we should be spending a little bit of tax money for paid family and medical leave. It always polls at about 70% for moderates, independents, and in the 80s, and if you're a woman of color, the 90s, if you're a Democrat, right? And so there's an overwhelming support in this country for policies like paid family and medical leave and paid sick days. Where it gets complicated is the lobbyists in Washington who are like sending another narrative out there. To your question, we talk about it like that. We also know that in some states, we couldn't have passed paid family and medical leave, even in some blue states, that have tight margins in the legislature without having some Republicans on. So Republicans have supported this and voted for it. And Republicans voted for paid leave in the Family First Corona Response Act. That's the only way, they were like moved by the pandemic and they did that. I think that for states like, Georgia, you're talking about, red soil, Georgia's purplish now, but, states that are staunchly red and won't be, will be red for some time. I think that they're going to struggle with this. And we're going to end up like in many places where there's good climate change policy in some states and not so good policy in others, where there's the right to abortion in some states and not so much in others, and where there's paid leave in some states and probably nothing in others. That's what's going to happen until there's either a federal standard or until we figure out in this country, how to get money out of politics. So all of those, the polling numbers can actually bear themselves out, and we can have the policies that people need and that everyone says that we want. Does that answer your question?
Yeah, absolutely. Thank you.
Let's take one more question and then I've got to go to class. You do too, probably. Are you just so anxious to get to class that we can't ask a question?
Thank you so much for waiting.
It's a pleasure. Thank you so much for coming.